My name is Dr. Alexandra Lewery, and I am a clinical audiologist here at Clearsound Hearing Centers, and today I will be discussing with you the various hearing healthcare professions. There are basically two main hearing healthcare professions. There are audiologists, and then there are hearing aid dispensers. So what is the difference between the two professions? Well, audiology is basically a doctoring profession. So in order to have the title of an audiologist, or AUD in abbreviation, it is a doctoring profession that require that person to go through a rigorous education in order to obtain that degree and experience. So not only did that person have to go through the regular 4 years of college, in addition to that, they also underwent a 4-year doctorate of audiology program that focused not only on hearing, but also other conditions and diseases of the ear, that focused on other ear issues such as central auditory processing disorders, hearing loss, vestibular assessment, and vestibular treatment. So for example, if you're getting really dizzy, dizziness spells, falls, faints, which can be a balance issue, an audiologist is the professional that is going to assess and provide vestibular rehabilitation for those issues. Audiologists also have a vast knowledge when it comes to tinnitus, which is a ringing or a buzzing sound in your ear that you have, which is for the most part resulting from some kind of hearing loss, as well as other medical aspects of the ear. In order to become an audiologist, not only do you have to go through a 4-year program, you have to also take many different classes, obtain over 1,000 hours of clinical practice, and do a residency as well. So an audiologist is a doctor for your ears. Now, on the other side of it, we have hearing instrument specialists or hearing aid dispensers, and their title would be not AUD, it would be HIS. So which stands for hearing instrument specialist. And these individuals are not doctors, and they don't have as rigorous or as vast of an education program because their education is only limited to specifically doing hearing aids. So it's more of a technical profession in that sense, where they can't necessarily diagnose hearing loss, they can't necessarily treat various ear diseases. If you have balance issues, they can't do any balance assessment or balance rehabilitation. They would have to take you and refer you off to a specialist that does deal with those kind of pathologies, which would be an audiologist. When you are in the position of choosing who you're going to go to for your ear conditions, you do have both of those choices. But do remember that an audiologist is a person that can actually diagnose your hearing loss legally. They are able to tell you what's going on and provide recommendations for you, whereas a hearing instrument specialist only specifically deals with hearing aids for basic age-related hearing loss.